Is ibuprofen safe for babies with fever? When your little one is feeling under the weather and running a fever, it's natural to want to help them feel better quickly. Many parents wonder if giving their baby ibuprofen is safe and effective. Let's explore what the science and health authorities say about using ibuprofen for babies with fever. Fever is the body's way of fighting infection. Usually, a mild fever isn't harmful but can make your baby uncomfortable. The main goal is to ease their discomfort, not necessarily to normalize the temperature. For babies under 3 months, any fever should prompt a call to your healthcare provider before giving medication. Ibuprofen is a common over-the-counter medicine used to reduce fever and pain in children. It works well, but its safety depends on the age of your baby. Generally, health authorities recommend that ibuprofen be used only in babies older than 6 months. This is because there is limited safety data for infants younger than 6 months, and regulatory agencies like the Food and Drug Administration do not approve it for use in babies under that age unless a healthcare provider advises otherwise. For babies between 3 and 6 months, some studies suggest that short-term use of ibuprofen may be safe if the baby weighs more than 5 to 6 kilograms and is well hydrated. However, this should only happen under medical supervision. Always consult your child's doctor before giving ibuprofen to a baby in this age group. Research indicates that ibuprofen may be more effective than acetaminophen at lowering fever and relieving pain in children under 2 years old, especially within the first 24 hours. But after that, both medications are similarly safe when used correctly. It's important to follow dosing instructions carefully to avoid side effects. Like all medicines, ibuprofen has potential risks. It can cause stomach upset and, in rare cases, affect kidney function, especially if your child is dehydrated. That's why keeping your child well hydrated while they have a fever is essential. There is no strong evidence that ibuprofen increases the risk of serious bacterial infections in children with fever. Acetaminophen, such as Tylenol, is considered safe for babies over 3 months old when given at the correct dose based on weight. Overdosing can cause liver damage, so precise dosing is crucial. When giving medication at home, always use the measuring device that comes with the medicine to ensure the correct dose. Ibuprofen is typically given every 6 to 8 hours, while acetaminophen can be given every 4 to 6 hours. Never give aspirin to children unless your healthcare provider specifically recommends it, because aspirin can cause a rare but serious condition called Reye's syndrome. Some parents think about alternating between acetaminophen and ibuprofen to keep the fever down. While this can be effective, it should only be done under medical guidance to prevent accidental overdose or confusion about dosing times. Supporting your child at home also includes dressing them in lightweight clothing, keeping the room comfortable, and encouraging fluids. Lukewarm baths can help reduce fever, but avoid cold baths or alcohol rubs, which can cause shivering and make your child feel worse. Always seek medical advice if your baby under 3 months has a fever, if a fever lasts more than a day in a baby under 6 months, or if your child's symptoms worsen or do not improve with treatment. When in doubt, consult your healthcare provider before giving any medication. In summary, ibuprofen is safe and effective for reducing fever in babies older than 6 months when used properly. For younger infants, especially those under 6 months, acetaminophen is generally preferred unless your doctor advises otherwise. Always follow dosing instructions carefully, monitor your child's response, and seek medical advice if you have concerns. Remember, every child is different, and your healthcare provider is the best source for personalized guidance.